Hello, I'm Felicia and I'm making a series of videos documenting a very difficult journey I've had through our healthcare system in the UK over the last 12 years as I've tried to get a diagnosis and treatment for debilitating left-sided facial pain. I've been highlighting the different failings and issues that I've experienced at different NHS trusts, and this video focuses on my experiences at NHS Lothian, which were far the worst out of all that I've experienced out of all of the 18 NHS trusts I've been to. At NHS Lothian, I experienced being silenced, I experienced discrimination, and I experienced a lack of duty of candour. In the spring of 2021, head and neck services at NHS Fife referred me to tertiary head and neck services at NHS Lothian about my parotid pain and my left masseter muscle. They had found enlargement of my left masseter muscle at NHS Fife. Unfortunately, with that referral was included a discriminatory letter that I've already talked about from a psychiatrist who had never met or spoken to me that said that I had factitious disorder and that I'm making up my facial pain. I saw the head and neck surgeon at NHS Lothian. He agreed to do a series of scans and get me back to find a way forward. I had the 3 scans. I had an MRI neck, an MRI brain and a CT neck scan. I never heard from the surgeon again. He didn't give me a follow-up consultation, and he stonewalled me and went silent on me for 18 weeks. I wrote to him 3 times asking him for a follow-up consultation and asking him questions about my condition, namely, is my masseter enlargement being caused by parotid tissue over my masseter muscle? And could my ear pain be caused by a damaged Eustachian tube? I received no reply. This was particularly difficult because during this time my left-sided ear pain was worsening. I had and still have a feeling of fullness in that ear, but it was particularly bad during that time. He referred me to NHS Fife pain management, who refused to see me, and he referred me to NHS Fife infectious diseases, who, in spite of finding 2 blood tests showing abnormalities with my raised infection markers, discharged me after 2 appointments and took no action. This surgeon at NHS Lothian wrote an obscene, discriminatory comment about me on a radiology request form. On the request form to the radiologist, who he asked to do a CT, a neck scan and an MRI neck scan of my head and neck, he wrote, "Be careful with this one. Patient has significant psychiatric problems." That was on a radiology request form. When I complained to NHS Lothian about the surgeon not giving me a follow-up consultation and asking why he refused to see me again, they replied by telling me to go to NHS Fife pain management. They did this knowing that Fife NHS pain management had refused to see me. They knowingly led me down a dead end. The questions and issues I've got with NHS Lothian are the following. Firstly, why didn't anyone in management catch that discriminatory comment on the radiology request form? And why did you breach your duty of candour and lead me down a dead end? Why did you tell me to go to a service that you knew had refused to see me? Why did you breach GMC guidance and leave me with no care? Good medical practice 65D states that a clinician must ensure that a clinician or team has taken over responsibility when your role in the patient's care has ended. You left me with no care. Why? Why didn't you ensure a clinician had taken over my care? There are still unanswered questions about my CT scans. They were done with you, and I've been round and round the houses asking for answers about this asymmetry, but I can't get any answers. You know, your treatment of me was dehumanising and degrading. Leaving me in silence for 18 weeks and then closing my file and leaving me with no care was not just a breach of GMC guidance, but it was unreasonable and hurtful. I'm asking you if you will please remove that discriminatory comment from the radiology request form. It has no place there, and it is producing systemic bias against me. That comment is now on my radiology files, and if, and they already have, a radiologist will request those CT scans as a comparative model, which is standard protocol when a patient has a long-standing condition like mine. They will see that comment and they will write me off as a fruitcake. Now, this has already happened when I went to see York Hospital following when I returned to England. They did some scans, they requested those scans from you, and they would have seen that comment. And that may explain why they haven't acted on an abnormal scan. Look, that's a discriminatory comment. It shouldn't be there. It should have been caught. So please, will you remove it? I'm also asking if you'll please answer my questions about my CT scans. They were done under your roof, so it's your responsibility to answer the questions. The main questions I've got is, what is this visible asymmetry in my face? Is my masseter muscle enlargement being caused by the parotid tissue that's over the masseter muscle? Has my nose, my nasal tissue and muscle started to wear away as a result of this infection? Because it looks like it has in the images. And is my orbital bone and facial bone now damaged as a result of this infection? Because the bone looks significantly different on the left side of my face. I'm going to show you these images. They're going to pass across the screen at the end of this video. But I would ask that you please consider removing that comment, because it's going to pose difficulties going forward for me regarding systemic bias. That was out of order for him to write that comment. And as regards your treatment of me, you know, that hurts so much. That silence, that 18-week silence hurt more than I think anything has throughout my whole 12 years. Silence really hurts. And you do have an obligation to answer questions that patients ask about their condition, and you didn't. So I would ask you to reflect on the way you behaved with me. But in the meantime, please will you remove that comment? And please, will you answer my questions about my scans? Thank you.